A year ago, when I got to start talking to Ken, it was more than a year ago, started talking to Ken and getting to know him. I came by, visited a while back. We planned, or at least talked about this particular evening, and here it is in fruition. And I hope you've learned a lot and got confidence and are going to move forward in your treatment. Let me tell you, on the first slide, there was lack of any information available to bladder cancer patients before September 2009. That's when two of us, Jack Moon, some of you have met him via the internet or met him via phone, and I got together and said, we've got to do something about this. And we've worked very hard, and we thank the volunteers who've joined us, made a difference, and we are making a difference, we believe, in the care that bladder cancer patients are getting, increasing awareness, and some other things which I'll talk about in a minute. Just something about me. 18 years ago, it will be in another 2 days, is when I found out that I had bladder cancer. And in another 3 days, 8 years ago, is when I had my bladder removed. So I've been at this thing for a long time, and I can tell you there's been I couldn't find any help, and it's awful scary. I don't have to tell you, when you're first diagnosed and you don't know where to turn to, you have nowhere to turn to, and I'm hoping that you're finding some information and some relief by getting the information you want, being able to talk to people online or via the internet. We moved the organization to a charitable registration, and we've been endorsed by the Canadian Urology Association. Our mission is to help bladder cancer patients and their team and handling the day-to-day issues. So we do this a number of ways, and I'll talk about that in a minute. We want to raise awareness, and we're doing that by this kind of a meeting, by putting posters out places, by getting publicity. Greg Neely, who you'll hear in a minute, has written countless number of articles, got them in various publications, and we're constantly working at this. And if any of you have any experience in this area, we're looking for help in raising awareness in the public domain. And the third thing we do is increase or get government funding and raise funding, and Ken related to this a moment ago about the walk. We have funded 3 major projects this past year, just recently. We have another major project coming down in medical research. And from what I've known and what I've heard from many of the doctors, research has not been, for bladder cancer, has not been a high priority. You've heard Dr. Drachtenberg talk about the BCG treatment and some of the other treatments, decades. He used the word decades old. I don't know how many other major cancers have had no research done in them, but we have very little research done in bladder cancer. This is our cancer, and we should be doing something about it. I look at the audience, and I think all of you know the word polio. And my peers and I grew up in that era, and unfortunately I've seen a couple of my peers at that time die, and some of them who are still alive today are walking around with the residues of that disease. In 1970, I recall this vividly, my 3 or 4-year-old daughter turned to me and said, we're watching television, black and white, and it was ironically a photo of Winnipeg, and it was iron lungs, and they were talking about polio. And my daughter asked me, what is polio? And I said, polio was. Someday I hope my kids will say bladder cancer was. And this is, we can make it happen if we start putting our minds and hearts to it. For your help and information, you can get onto the website, and you can get onto our discussion forum. If that concerns you going public on it, you can go private. People will answer your emails. People will pick up the phone and call you. So you just have to, pose your questions to us. Part of our mandate is to get the patient education meetings going across Canada. We've had 4 of them, or will have 4 of them, 1 more in November in Vancouver, where, as I said, we funded for major medical research. We're having the awareness walk, and we're asking if you have any concerns about your health and the future of bladder cancer, that you get involved if you can. You're volunteering for 2 or 3 hours a week or 2 or 3 hours a month, whatever it is. If you can't walk, then come out to the walk and be there and support us. And the press will pick up on this thing, that there are lots of people out there standing and wearing bladder cancer T-shirts. The walk, as Ken said, is going to be on Sunday, September the 23rd. There's all kinds of information for you outside at the back. You can register, you can speak to Ken, and he'll give you other information about it. I can't say enough about that wonderful volunteer that you have here in Manitoba. Ken, it's just been terrific. He's taken on this thing like a bulldog, but I know he, like us, like myself, Jack, Greg, have gotten back so much from giving, and it's a marvelous feeling. And if any of you would like to get involved again, we welcome you. You can do it, work with Ken here, or nationally, we can use your help as well. I'd like to thank Elizabeth. I'm going to go through a little bit of what Ken did, but we both feel so strongly about this. Cancer Care Manitoba and Elizabeth, thank you for coming out, and we look forward to working with you in the future as well. The resources that they have, we hope to have some of the videos of the speakers tonight available to you. We'll let you know, especially if you've signed up, and we'll get you an email to you to tell you that the videos are available. Doctors, thank you again for everything you do. I'm here 18 years later, and it's very much like the doctors like yourself, and I can't tell you how much you mean to me. And thanks for everything you're doing. And Wendy and Heather and all the other volunteers, again, thank you so much. And just want to tell you that following Greg's presentation, please fill out a card back there if you haven't. Give us your information. You're going to have an opportunity to meet with the presenters. The doctors will stay back, as will Elizabeth. I want to tell you that you can visit the Coloplast display. I happen to be one of their users. I have a urostomy, which, as I said, I had done 8 years ago. And they'll answer questions for you and give you samples if you need that. And you can learn more about the walk and so on. It is a great privilege for me to introduce Greg Neely. Greg is a director of Bladder Cancer Canada. He'll tell you his story. I've got to tell you, I've listened to Greg 4, maybe 6 times now, and he is an inspiration. I'm sure you'll find a wonderful speaker, and I trust you'll enjoy listening to him and getting so much out of his presentation. So again, thank you, and we'll see you after the meeting in the back. Thank you.